Did you know that spotting early signs of prostate cancer could be the difference between life and death? What if something small you're ignoring right now is a warning your body is giving you? It might be hard to believe, but those little changes could be a life-saving signal. Let me tell you the story of Mr. Thompson, a 72-year-old man who thought his body was just aging. He began noticing subtle changes. Frequent trips to the bathroom at night, a bit of pain here and there, but he didn't think much of it. It wasn't until these small signs added up that he learned how serious things really were. His story might just save your life too. In today's video, we're diving into the 6 early signs of prostate cancer that you should never ignore. Stick around, it could make all the difference. Sign 1. Frequent urination. Mr. Thompson, a 72-year-old man, had always been healthy and active throughout his life. However, as the years went by, he started noticing something odd. He was waking up multiple times during the night to use the bathroom. At first, he thought it was just a part of aging, something that most people his age experienced. After all, it's normal for older adults to make more frequent trips to the restroom, right? But as the weeks went by and the frequency increased, he began to wonder if something else was at play. What Mr. Thompson didn't realize at the time was that frequent urination, especially at night, is one of the early signs of prostate issues. The prostate, a small gland located just below the bladder, can start to enlarge as men age. This enlargement, often referred to as benign prostatic hyperplasia, BPH, can push against the urethra, making it harder to fully empty the bladder. The pressure results in more frequent trips to the bathroom, particularly during the night, a condition known as nocturia. What Mr. Thompson thought was just a normal part of aging turned out to be a red flag. While it's true that aging can bring about changes in urinary habits, frequent urination can also signal more serious issues, such as prostate cancer. The early stages of prostate cancer can cause symptoms similar to BPH, like difficulty urinating or the feeling that you have to go all the time. In Mr. Thompson's case, the frequent trips to the bathroom were among the first signs that something was wrong, but he didn't think much of it until his condition worsened. If you're noticing that you're waking up multiple times during the night or needing to urinate more frequently throughout the day, it's time to pay attention. These seemingly harmless changes in your body may be early indicators that something more serious could be happening. Ignoring these signs can delay diagnosis, and when it comes to prostate cancer, early detection is key. Mr. Thompson's story could have ended very differently if he hadn't taken the time to talk to his doctor when the symptoms became more persistent. The best thing you can do is to be proactive about your health. Pay close attention to any changes in your urinary habits. If you find yourself making more trips to the bathroom or struggling to hold it in, don't brush it off as just another sign of aging. Talk to your healthcare provider and share any concerns you may have. Early intervention can make all the difference in catching prostate issues before they progress. Remember, staying informed and being proactive could save your life, just like it did for Mr. Thompson. Sign 2. Difficulty starting or stopping urination. Mrs. Simmons, a retired teacher, always believed that her husband, Mr. Simmons, was a picture of good health. However, over the last few months, she started noticing that his trips to the bathroom were taking longer. He seemed to struggle with starting urination, and when he finally did, it wasn't always easy for him to stop. At first, Mr. Simmons chalked it up to stress, something he could easily brush off as part of the aging process. But Mrs. Simmons couldn't shake the feeling that something was off. She gently encouraged him to go to the doctor, but he hesitated, convincing himself that it was just a minor inconvenience. What Mr. Simmons didn't realize was that difficulty starting or stopping urination is a common sign of prostate problems, including prostate cancer. The prostate gland, which sits just below the bladder, plays a crucial role in urinary function. As the prostate enlarges, whether due to benign prostatic hyperplasia, BPH, or cancer, it can put pressure on the urethra. This pressure can interfere with the normal flow of urine, making it harder to start urinating or to completely stop once the stream begins. In Mr. Simmons's case, what he thought was simply a nuisance, like stress or aging, was actually an early warning sign. The prostate is notorious for showing subtle symptoms in the early stages of cancer, and difficulty controlling urination can be one of those signals. As the cancer or benign enlargement presses on the urethra, it becomes more challenging to manage the flow of urine, leading to hesitancy, dribbling, or a feeling of incomplete emptying. For Mr. Simmons, it wasn't until the problem worsened that he realized he should have paid attention to these signs much sooner. Prostate cancer can sometimes develop slowly, and by the time symptoms become obvious, it may have spread. Mrs. Simmons's persistence finally paid off when her husband agreed to visit the doctor. After a thorough examination, he learned that his struggles with urination were indeed linked to prostate issues. Fortunately, by catching it early, they were able to take action before the situation worsened. However, if they had waited longer, the outcome could have been much different. It's important to recognize that these types of symptoms should never be dismissed as just another aspect of aging. In fact, hesitancy or difficulty in starting or stopping urination can signal something much more serious. If you or a loved one is experiencing difficulty controlling urination, whether it's a struggle to get started or a problem stopping once you begin, it's time to make an appointment with your doctor. These changes might seem small, but they can be critical early indicators of prostate problems. Don't wait for the situation to escalate. Getting checked out early can lead to early diagnosis and more effective treatment. Like Mr. Simmons, it's essential to take these signs seriously and not brush them off as part of getting older. Your health is too important to ignore. Sign 3. Blood in urine or semen. Mr. Thompson, now 72 years old, recalls the day he first noticed blood in his urine. He had just finished his morning routine and, as usual, went to the bathroom. But this time, when he looked down, he saw something that caught him off guard. Blood in his urine. At first, he thought it was just a fluke, maybe a small injury or something unrelated. He brushed it off, thinking it would go away on its own. After all, he had never had any issues with his urinary health before. But over the next few days, the blood didn't stop. It became more persistent. That's when he realized this wasn't something he could ignore. What Mr. Thompson didn't know at the time was that blood in the urine or semen is one of the more alarming signs that could indicate prostate cancer. While blood in urine, hematuria, can sometimes be linked to urinary tract infections or kidney stones, when it appears without an obvious cause, it can be a red flag. The prostate gland, when affected by cancer, can cause blood to appear in both urine and semen. This happens because the cancer can cause blood vessels in the prostate to rupture, releasing blood into the fluids. Mr. Thompson's situation was serious, but by the time he noticed the blood, it was already time to get help. Despite his initial hesitation, Mr. Thompson decided to visit his doctor. After reviewing his symptoms and conducting some tests, his doctor immediately recognized the presence of blood in his urine as an indicator of prostate cancer. It was a wake-up call. The cancer had begun to affect his prostate and the surrounding tissues, causing the blood in his urine. Luckily, because he sought help early, his condition was caught in the early stages, allowing for a more effective treatment plan. Had he ignored this sign, the cancer might have progressed without him even knowing. Blood in urine or semen is never something to ignore, no matter how minor it may seem at first. It's easy to assume it could be caused by something trivial, but this is one of those symptoms that should always be checked out by a healthcare professional. For Mr. Thompson, the discovery of blood was the catalyst that led him to seek medical attention. His willingness to act quickly ultimately helped him avoid a more serious situation. But not everyone is so fortunate. If you notice blood in your urine or semen, don't make the mistake of thinking it's nothing. This could be a sign of prostate cancer, and the sooner you get checked, the better. Even if you think it's something minor, it's important to let your doctor take a look. Catching these symptoms early can make all the difference in your health and well-being, just like it did for Mr. Thompson. Don't ignore the signs. Your life may depend on it. Sign 4. Pain in the lower back, hips, or pelvic area at 75. Mrs. Johnson had always been active, walking around her neighborhood every morning and staying involved with her friends and family. However, in the past few months, she started experiencing constant pain in her lower back and hips. At first, she shrugged it off, assuming it was just arthritis, something she had dealt with for years. She had seen her doctor a few times for the discomfort, but they mostly prescribed pain relievers and recommended gentle exercises. But as the pain persisted and even started to get worse, Mrs. Johnson couldn't ignore it anymore. Something felt different, and she decided to take her concerns more seriously. What Mrs. Johnson didn't know was that persistent pain in the lower back, hips, or pelvic area could be a sign that prostate cancer had spread to the bones. Prostate cancer has a tendency to metastasize, spread, to the bones, particularly the spine, hips, and pelvis. When the cancer spreads, it can cause severe pain in these areas due to the tumors pressing on the bones or nerves. In Mrs. Johnson's case, what she had initially written off as arthritis was actually a sign that the cancer was advancing. Her story is a reminder that pain, especially when it's persistent and unexplained, should never be dismissed as just part of getting older. It wasn't until Mrs. Johnson mentioned her pain during a routine checkup that her doctor raised a concern. After some tests, including imaging scans, they discovered that her prostate cancer had spread to the bones in her lower back and hips. Although it was a difficult diagnosis, Mrs. Johnson's early attention to her symptoms allowed her to start treatment promptly. Had she waited longer to seek help, the cancer might have spread even further, making it much harder to treat effectively. Her story illustrates how important it is to listen to your body and speak up when something doesn't feel right. Unexplained or constant pain, especially in the lower back, hips, or pelvic area, is not something you should ignore. It could be a sign that cancer has spread, and the earlier it's detected, the better your chances are for successful treatment. Pain can be caused by many different things, but when it becomes persistent or unusual, it's a signal that something is wrong. Whether it's a dull ache or sharp pain, don't assume it's just part of aging or a minor issue that will go away on its own. Like Mrs. Johnson, seeking medical advice could help you catch something serious before it becomes harder to treat. If you're experiencing ongoing pain in your lower back, hips, or pelvis, it's important to consult with your doctor as soon as possible. Don't wait for the pain to worsen. Early detection of prostate cancer or any other condition is crucial for effective treatment. Remember, your health is too important to take chances with. Mrs. Johnson's experience serves as a powerful reminder that unexplained pain is never just normal, and the sooner you address it, the better your chances for a positive outcome. Sign 5. Painful ejaculation. Mr. Thompson had always been in good health. He had no major medical issues and lived an active life well into his 70s. However, one day he noticed something troubling: pain during ejaculation. It was subtle at first, just mild discomfort, but over time it became more noticeable. At first, he thought it was due to something minor, perhaps stress or aging. But as the pain persisted, he began to worry. After all, he had never experienced anything like this before. Hesitant to bring it up, he kept it to himself for a while, hoping it might go away. What Mr. Thompson didn't realize was that painful ejaculation can sometimes indicate prostate problems, including prostate cancer. The prostate gland plays a key role in producing seminal fluid, and when it becomes inflamed or affected by cancer, it can cause pain during ejaculation. This sign, while often overlooked, can be an early warning of a serious condition. For Mr. Thompson, what seemed like an odd temporary issue turned out to be a symptom that should not have been ignored. Prostate cancer, when caught early, can often be treated effectively, but pain like this can be a key signal that something isn't right. After several weeks of discomfort, Mr. Thompson decided to consult his doctor. After conducting a thorough examination, his doctor explained that painful ejaculation can be caused by prostate problems, including infection or cancer. In Mr. Thompson's case, the pain was linked to early-stage prostate cancer. It was a wake-up call. What he thought was just an unusual discomfort turned out to be a significant sign that his body was trying to tell him something. Thanks to his doctor's swift intervention, they were able to catch the cancer early and start treatment right away, which greatly improved his chances of recovery. Painful ejaculation, especially when it's a new or unexplained symptom, should never be ignored. While it may seem like a minor issue, it could be an indicator of something more serious, like prostate cancer. Many people are reluctant to talk about sexual health problems, but in reality, they could be crucial early signs of a medical condition that requires attention. Just like Mr. Thompson, you might dismiss it at first, thinking it will go away, but it's important to seek medical advice as soon as possible. Early diagnosis of prostate issues, including cancer, can significantly improve treatment outcomes. If you experience pain during ejaculation, especially if it's a new sensation for you, it's essential to consult your doctor. Painful ejaculation could be a sign of prostate cancer, and the sooner you address it, the better your doctor can perform the necessary tests to identify the cause and recommend the right course of action. Remember, no symptom should be brushed aside, especially when it comes to your health. Like Mr. Thompson, addressing this issue early on can make all the difference in getting the right treatment and taking control of your health. Sign 6. Decreased libido or erectile dysfunction at 78. Mr. Carter had always enjoyed an active life with his wife. From daily walks to frequent outings, their relationship remained strong both emotionally and physically. However, one day he began noticing something strange. Despite his usual energy and affection toward his wife, he found that he couldn't maintain his usual sexual activity. At first, Mr. Carter chalked it up to the natural effects of aging. After all, he was getting older. But the issue persisted, and he noticed it wasn't just a temporary problem. This was different. It wasn't just about being tired or stressed. It was something deeper. That's when he realized he needed to seek help. What Mr. Carter didn't realize was that erectile dysfunction, ED, and a sudden decrease in libido can sometimes be early signs of prostate cancer. Prostate cancer can affect the body in ways that directly impact sexual health, including altering hormone levels and disrupting the physical functions needed for sexual activity. The prostate gland plays a vital role in sexual function, and when it's affected by cancer, it can lead to issues like erectile dysfunction or a decrease in sexual desire. Mr. Carter's struggles were not just signs of aging but signals that something more serious could be at play. After several months of trying to ignore it, Mr. Carter finally decided to talk to his doctor. During his consultation, his doctor explained that erectile dysfunction and decreased libido are common issues when it comes to prostate cancer, especially when the cancer interferes with hormone production or when treatments for cancer, such as hormone therapy, impact sexual function. Mr. Carter's symptoms were directly linked to early-stage prostate cancer, and he was relieved to have caught it early enough to begin treatment. Had he waited longer or assumed it was just aging, his situation might have been more difficult to manage. It's important to understand that a sudden decrease in libido or erectile dysfunction shouldn't automatically be attributed to aging. While these issues can become more common with age, they can also be symptoms of underlying health issues, such as prostate cancer. Just like Mr. Carter, many people mistakenly think their sexual health problems are a normal part of getting older. But it's crucial to listen to your body and take action when something feels different. These symptoms can be early indicators of prostate issues, and early detection can greatly improve your chances for successful treatment. If you're experiencing a sudden decrease in libido or erectile dysfunction, don't hesitate to consult your doctor. These symptoms can be linked to prostate cancer, and getting checked early on can help you avoid more serious health consequences down the road. Sexual health is an important part of overall well-being, and addressing these changes sooner rather than later can help you stay on top of your health. Mr. Carter's experience serves as a powerful reminder that issues with libido or erectile function should never be ignored. Consult your doctor, take control of your health, and get the help you need. Thank you for watching, and remember, early detection is key when it comes to prostate health. If you're experiencing any of these signs, don't wait. Consult your doctor and take action today. Just like the stories we shared, catching potential issues early can truly save your life. If you found this video helpful, please leave a comment below with either a 9 if you learned something new or a 0 if you're going to take action right away. Don't forget to subscribe for more healthy tips and life-saving advice. Stay healthy, take care, and we'll see you in the next video.